So as Menlandy have said and indicated, these themes are very overlapping in the way that we're discussing them. So some of the features, but they have these particular angles on the discussion. So some of the themes I talk about will be have been mentioned before, but they're coming at this from a slightly different perspective or angle. And when I'm talking about validity and trustworthiness, I'm really using quite a broad definition of those terms. Part of the reason being is not to say that definition isn't important, but we have a huge range of disciplinary backgrounds, methodological traditions that have engaged with the workshop, or that have published with the project, that have published ideas around these issues. And so and also that our audience here is from all kinds of different disciplines and sectors of research. So that's not to say that there wasn't a difference in the way that these things were talked about, and particularly as Mel pointed out, there was two perhaps stronger strands in the rapid evidence review, one towards survey discussions and one towards autoethnographic discussions. And so they have quite particular ways on thinking through these problems. And so just to sort of set the scene a little bit, this is how the problem emerges in some of the quotations. So we get, how can we ensure that conclusions drawn from data collected during the pandemic are valid and representative and generalizable to a post-pandemic world and comparable to a pre-pandemic one? So there's very much a sense here of something changing over time, and the very world itself being substantially different, and the effect that's having on comparability and the ability to work with data across these different times in the way that that's understood. And within that is this kind of question of, is this a COVID study, or how is it not a COVID study that I'm now working on? And similarly, what are the implications for reliability and validity of data if one research project combines data collected using both face-to-face and remote interviews? And so this is more centered around changing the method, or having to use composite methods in the research and so on, which are two kind of strands that come out in the literature. And some examples that we have of these things. So harder to reach groups are harder to reach. So this has issues around, how do you know that you're getting at the issues or populations that you're most interested in trying to research and understand? If your research is using data on health, that can be very difficult to interpret given the way that health is being reported and the confounding aspects of COVID. There's a possible loss of integrity in the way that participants engage with or perceive the projects themselves. And we had an example of somebody in workshop 5 discussing trying to work with participants who are used to working in face-to-face environments, and switching that to an online collaboration proved very challenging with those particular with that particular community. And we have the issue of rapid research, which can present problems to the validity in terms of knowing that you've done the right analysis, or that the data checks have been sufficient, and so on. Excuse me. And so one of the issues that's kind of crops up in this is how things themselves seem to change or disappear and appear. So organizational and bureaucratic classifications, for example, trying to understand a population, the way a particular organization was classifying those populations has disappeared because of COVID. So they no longer have those classifications, and that can make a significant problem for comparison across different or even tracking populations across time through the pandemic. We had an example of children's play, which has both changed partly because schools are changing their functioning, and obviously at the moment most schools are pretty limited in the number of students they're having, and lots of people are being homeschooled. So the way that children are playing in bubbles or outside of those, outside of school, and the incorporation of COVID-19 knowledge to make sense of the pandemic into play is important. And that sociality is changing. So in participatory research, the ways that we had researchers discussing the forms of sociality in which they were had initially started to research with their participants changing. And obviously that has a particular issue in participatory research, in which it's, as I'll come on to a little bit later, the philosophy and ethics behind participatory research are really important in terms of its validity. So in terms of the changing in methods, and this has been spoken about by Mel and Andy already, but we have mode changes. So the transparency of change is a crucial thing. And Gummer et al. Say, in our opinion, clear and timely accounts of how surveys were affected by the COVID-19 pandemic are essential, and circumstances of data collection and the mode effects and key transparency around protocol changes are what's really important. And the Understanding Society, for example, which is the Burton et al. Paper there, were saying that they were well placed to shift from face-to-face fieldwork to web-first interviews and pick up non-respondents followed up by the telephone, and then have worked out how those changes in mode to web-first and computer-aided telephone interviews have affected their data collection. We have representativeness being addressed using Facebook to as well as reducing the cost and shortening recruitment periods, that it was enhancing the representativeness of target populations. And moving to digital, obviously this is a significant issue, but in terms of ethnographic immersion, there's been a long history of there is a history of ethnography moving to online and virtual considerations, but those ways of doing ethnography that involve face-to-face interaction, asking directions, or just asking somebody in a public place what's going on, that changes significantly when you're moving online and that kind of interaction. So in the survey literature, there's a range of ways that the validity and reliability issues were addressed. So using bespoke rapid surveys, using supplementary surveys. So that's using a COVID-focused section on an existing longitudinal survey, or using a subsample of COVID-related inquiries. So being able to compare the subsample with the overall cohort, or separate COVID-specific questions at the ends of interviews. And in terms of rapidity and the speed of research, which is quite a key concern, particularly for research to be relevant, and there's this idea, as I mentioned, that survey researchers and longitudinal studies already have a well-established infrastructure to respond to certain issues, but they also have the potential for comparable data, depending on how that's been collected and understood across the time of the study. But as excuse me, Connolly and Gale point out, these rapid methods can be opportunistic and they can compromise reliability modeling. And Vernon may pick up on that issue a little bit later as well. We've had the theme of relationships come up already, and in terms of validity, it can be really important to have good relationships with participants to ensure that their continued engagement with longitudinal studies, and that building trust in community members online can be very difficult if those communities have previously not experienced that, and it's important to build in how to do building trust in order to make that kind of research valid and relevant to the communities. One of the key things that came out, particularly in discussion in the workshops, but is also in the rapid evidence review, and is this rearticulation of theory, revisiting philosophy and theory that was underpinning the research. So to check that any change in method or approach was still consistent at some level with the original research aims or underpinning philosophy. And so that was, as I've said, quite important in participatory research, where it's really crucial to have good relationships with the participants and have the ethical approach in order to, or certainly some participatory research, to have the validity and relevant research. And then in the autoethnographic and ethnographic discussions, deploying Barad and Haraway to understand or conceptualize autoethnography as a relational endeavor, and ethnography as something that is inherently responsive in its mode and the way in which it progresses anyway, and to be able to reflect on that is crucial. So to conclude this section, we've had changes in mode and method, in the objects of the research, and in the participation and sociality that the pandemic has caused by its restrictions and by the risks, the health risks that we've had, and various changes. We've had researchers working different ways to use theory or methodologies to address issues of consistency and coherence and generalizability, and this is particularly within the temporal aspects, and those accounting for effects particularly in surveys and in ethnography and interviewing.